So we went to speak to an insurer. He's called John Baackes, and he represents another player in the complicated U.S. healthcare system. Medicaid and Medicare are insurance plans, but there are also independent companies that administer those plans and other private healthcare plans, and these are the insurers. Honestly, it all makes my head hurt.
John is CEO of LA Care Health Plan. It's one of the biggest insurers in Southern California. To continue with the headache-inducing confusion, John is kind of an unusual insurer because his healthcare plan in LA is not a normal for-profit business. It's an organization that the California government created to help run the healthcare for Medicaid patients in the state, and it's funded by the government.
Another weird aspect of the U.S. healthcare system, Medicare and Medicaid are national programs, but they're actually operated on a state-by-state basis, which means individual states can all implement their programs slightly differently.
John's organization, LA Care, is responsible for insuring 2.5 million people in Los Angeles. John knows he can't exceed his government budget, but he's not trying to make a profit, and he can test programs to improve healthcare even on a citywide basis.
Before he moved to LA, John was the CEO of a big healthcare plan in Philadelphia. And that's where he got introduced to the idea of medically tailored meals. Project Angel Food has a sister organization in Philly called MANA.
We paid for a study that looked at the utilization of medical services by people who were receiving the MANA meals, which were also medically tailored. And the study was absolutely convincing, and this is 12, 15 years ago, that there was a correlation between treating food as medicine, prescribing meals to people that were nutritionally targeted at their health status, and we saw a precipitous drop in emergency room utilization, readmissions to hospitals.
Before this study, John would never have considered reimbursing for meals. It just wasn't on his radar.
When I was first introduced to the idea, it was like, oh, I never thought of that. And when I saw the results of this study, which were amazing, I said, well, this is a no-brainer. Why aren't we doing this?
This experience was all it took to convince John that the financially responsible thing to do as an insurer was pay for these meals. When he moved out to LA, he got connected with Project Angel Food pretty quickly.
Los Angeles is the largest county in the United States with 10 million people. So a quarter of the population is in our health plan.
Which is a lot. And even before California decided to reimburse for medically tailored meals, John straight up dipped into his reserves and gave Project Angel Food a grant to make sure that a bunch of his clients who really needed these meals got them.
But like we said, since earlier this year, these meals are one of a number of things that the state will help pay for in their healthcare plan that aren't actually drugs or medical procedures. All the things on that new list of community supports are important. They're all critical pillars for someone on Medicaid. One of the things Medi-Cal now can even pay for is getting someone housed. But to John, medically tailored meals are actually the quickest win.
Of all of the community supports that are out there, that is probably the one that has the biggest bang for the buck.
John thinks that tens of thousands of his clients would qualify for medically tailored meals. They're just not signed up yet.
Now, so when I say tens of thousands, if we said 10% of our members were eligible for it, that's 250,000 people. And I don't think it's a stretch to think that 10% of our members may benefit from it.
But there are a number of obstacles to getting people to sign up for these programs.
Well, number one, the providers don't know about it and the beneficiaries don't know about it. As I like to say, Medicaid beneficiaries are not middle-class folks. They don't wake up in the morning thinking, oh, wow, it's time for my annual mammogram. They wake up in the morning saying, do I have enough money to pay the rent?
And even for the providers, John says it takes at least 2 to 3 years for awareness of new programs to spread through the system.
Another issue is the predictable one of paying for these meals.
The amount we get reimbursed, the guideline that the state put out was a joke. They thought it was $7.
That's way less money than it takes for food and all the services that Richard provides.
As someone once said to me, no politician has been elected running on a platform of, let's pay more for Medicaid. Medicaid is not properly funded, and when you consider a third of the state of California is in it, it's not right.